hot, right?
Oh my God, it's so hot outside. I'm like sweating.
I know. I think it's been like 80s and 90s the past week. I feel like there's a whole heat wave here in New York City. Thank you so much for being with us today in a hot 5 p.m. New York City time. So, when I was telling my friends the other day, right, oh, I'm gonna go online with Doctor. Her account is Hey Siri MD. My phone kept like going up, and I'm like, "Hey, what's going on?" I didn't call Siri. I was like, "Oh, Hey Siri." I'm like,
Oh,
"That's why. That's what's going on." If
so
you could,
fun.
I know. If you could first please introduce yourself to everybody. As
Sure.
I
So my name is Dr. Siri Chamarti. I am an emergency medicine physician in New York City. I am ultrasound trained, and yeah, what's up, New York?
What's up, New York? Like they always say, right? New York or nowhere.
Yeah, it's definitely if you can make it here,
Like
anywhere.
anywhere. But you're not originally from New York, right?
No, I grew up in like Southern California, and then Georgia, and then to New York, so kind of like all over.
You literally went like from west down to south all the way to the east.
I know, I know. What about you? Where are you originally from?
I've been East
Oh,
Coast ever since. New York or nowhere. That's where it's true here. So if you can tell us about the long journey that it took to get there.
sure. So for people who are pre-meds, it's a long journey. In high school, I felt like pretty honestly pretty average. And then I felt like everyone was really smart because they were going to like Ivy League schools and whatnot. And I went to my school, I went to UCLA, so it's in-state.
Ruins.
Exactly. And then getting into medical school was like a really, really tough thing, you know? I got into an MD school, like Medical College of Georgia, and so I went to Georgia. I think the hardest part about this whole journey is actually like making medical school. Once you're in medical school, then the rest is like kind of like set for you. That's the hardest part is like getting that far. It's honestly like I think the struggles that you face are mainly because there's a lot of peer pressure in terms of like having to do certain things. Like, oh, you didn't do biology yet. Like you're a third year. You're like you need to do biology
Yeah.
or take a gap year or whatever. You know what I mean? Like it's been a long journey, I guess, and it's hard to like knowing what you want to do. And like
Mm.
even like once you do it, then you're like still not sure what you want to do, you know? So yeah, that's
Yeah.
that's the long and short of it. It's hard because everyone's journey is different and everyone comes from a different spot. Like some people come from like generational wealth where they're like, oh, I don't have to get good grades, or oh, I have to get good grades, but I
Yeah.
know get me in, or my mom
Yeah.
can. And some people like come from like no medical background.
Mhm.
If you come from no medical background, then your journey is much, much tougher.
So for you, was there a medical background? Did you
No,
get
my family's a doctor, so I'm
uh,
the first one, and I'm a first generation immigrant. So
mhm.
I literally like my parents had no idea what exactly if go to like school here. They're like,
Yeah.
what are these AP classes? I'm like, mom, let me do my thing. This is to explain. We have to do these to get from one place to another, you know? Or like they didn't know a lot of things when I was going to school. So my brother,
Mhm.
7 years younger than me, when he was going to school, they knew all the things that I had gone through.
Yeah. 'Cause you've gone
Yeah.
through it already.
I mean, for the better, for the worse. I mean, I guess it was more lax because they didn't know I
Yeah.
had things. And then in the sense, not more lax because I didn't have any like guidance as to
Yeah.
like choosing but like I think like an important thing to know is like it doesn't matter where you're educated, it doesn't matter where you go to school, you
Mhm.
always end up where you need to be.
Mhm. Yeah.
Like
So where did the inspiration come from them if none of your parents were a physician? What told you that, oh, I want to become a doctor one day?
so I was like thinking about different things I wanted to do, and I actually went to this like CIA meeting when I was in college because I was like maybe I buy I think I'd be like there's different things. And
Mhm.
so I like just kind of was like exploring different fields. Well, my dad's like an engineer, so
Mm.
essentially like I knew what that meant, and that wasn't my thing. Like I wasn't so excited when I saw that the circuit worked. I was like,
Yeah. Yeah.
it doesn't like turn me on like that.
Yeah. Yeah.
For me, I always thought like medicine was like a way to do like everything else. You definitely make an impact on people's lives where it's most vulnerable. It's a really like stable career. Most of the times you keep your job.
Yeah.
And also like you really get to like change people's lives. And I think that's like the thing is like our generation is obsessed with that. like with startups, with changing people's
Right?
lives, with
Yeah.
like making new innovations happen.
Yeah.
Great place for it. And you can
Yeah.
also branch out from medicine to
Mhm.
say
Mhm.
you're like, oh, I actually want to do like business. You could do like medical industry,
Yeah.
or
Yeah.
like, oh, say I like actually want to do law. Like there's a lot of ethics
Yeah.
like, involved
Yeah.
as well. And like it's like a good way to branch out. So I was like, I'm just gonna be like doing something broad until I figure out
Yeah.
exactly what I want to do. And even now, I'm not sure still 100% what I want to do because I'm
Yeah.
still early on in my career. You know,
Yeah.
education has been something that's been exciting to me. So
Yeah.
that's
I
why.
mean, even in school for a while.
But
Yeah.
honestly, we complain about school so much.
I
You
know.
miss it after. You're like, where are my friends? I just miss sleeping in the
I
back.
know. I know.
Like, it's not about the actual like material. It's more
Yeah.
about like, oh, okay, like what do you like achieve with what you have?
Yeah. But like you said earlier, the whole path is long and it's like, it's arduous, it's stressful, but really it's the whole process of getting into medical school, right? But I feel like pre-med culture in undergrad is like so toxic, right? In the sense
Yeah.
that it can get toxic in the sense that you're basically competing for those limited spots in medical schools with the rest of the students, right? Oh, what grade did you get in bio? Oh, you didn't take bio yet? Oh, do you have research? I have research, stuff like that. If there is a pre-med student right now who's like in the crux of giving up in this journey, whether for reasons like, oh, it's too hard, it's too long, or the process itself is hard, as someone who has gone through it and it's like you're already there, what is one piece of advice that you would give them?
So it's long and hard, but it's worth it. Okay, so I'm just gonna preface this by I was not a great student. Like not like everyone was like trying to sit at the front of class, and I'm like, you know, I'm sitting in the back, like most of my friends. Yeah, exactly. Like, or like I didn't go to class half the time, and or I like scheduled class like 2 days a week, and I'm like, yeah, like I have other things going on. Like, oh, my friend is turning 21 tomorrow. Like, I don't want to go to Friday.
Yeah.
No, but honestly, okay, so here's the breakdown. It's kind of like fish in the water, and like you're like, oh, this one flaps like better than the other one. So
Yeah.
but what's going to distinguish you when it actually comes to your applications is your personal statement and your journal. Like, if you're like the cookie cutter like applicant, that might
Mm-hmm.
be you if you have like the highest scores. Back in my day, the MCAT
Mm-hmm.
score was out of 45. But
Yeah.
like scores a person that they're not going to make a medical doctor.
Mm-hmm.
I think like one of the things that you can improve being a pre-med student that's actually going to benefit you in life is taking like English classes, like just writing classes. They will benefit you far more than
Yeah.
your OChem classes are great.
Yeah. Physics.
But steric hindrances. I like
There-
that term. Don't even like I'm like that's what I used to know about. Or like some
Do you
sequence.
use steric hindrance in the emergency room?
So actually, it's fascinating because there are certain applications of
Mm-hmm.
biology or organic
Yeah.
chemistry which actually
Yeah.
directly into patient care, right?
Yeah.
So if you get someone with cyanide toxicity, you need to know that it affects the pathway, the oxygenation. Okay, so essentially, you have to know that before you giving them methylcholine blue,
Mm-hmm.
then you need to like get all the blood from them because that's like how the actual chemistry works. But you're not like sitting there like, oh my god, let's think about this drug right now.
Oh
Okay,
my god.
okay. No, for real though, it's like hard, like not everything is like one to one, but all of the knowledge that you gain as a pre-med, like a lot of it, like you might like not remember everything, but it's the concept that will stay with you for a really long time. And those concepts are going to be really, really important. Like I use physics like normally, and I hate physics. And
Yeah.
I'm there at bedside doing an ultrasound,
Yeah.
calculate the area under the curve because that's
Yeah.
this
Yeah.
means like
Yeah.
real like really good to like know those things.
Yeah. And I feel like a common question that I actually received in DMs when I started promoting our live is from pre-med students, and I think the biggest fear is, oh, doc, I don't have a 4.0 GPA. Oh, I got a C in this class. Oh, my GPA is not that high. My MCAT score is not that high. Should I even bother applying to medical school? For sure, you've been with residents at this point and interns as well. And you said the important parts of the medical school application. How much do you think these numbers, like GPA and MCAT, really bring to the table when it comes to admissions to medical school?
So the medical school admission process is like changed tremendously, like evolved over the course of years. Like now there's more quote unquote holistic approach. There's treatment for more diversity,
Mhm.
yada yada. So with these things, like I recently went through the medical school application process with my brother, and his GPA was fine, whatever it was, thing, and then his MCAT score was like not the greatest. But based on what I knew about applying, which is basically you have to apply early. Like if you apply in the first day, you're going to be the first applicant that they see this cycle, and they're
Yeah.
gonna be like, "How, Chris Franz? He's like he's a hot shot. He did a post back. Oh my god, he's connected with all these other people. He's professional. He gets along with all these. Like, there's a lot of like
Mhm.
was that they can look from your
Yeah.
application. So if you apply later, that same Chris Franz that they were like, oh man, Chris Franz was some hot stuff. They're like, oh, Chris Franz, we've seen the other Chris Franzes
Yeah.
and they're better. You
Yeah.
know what I mean?
Yeah. 'Cause most
So
of them are rolling admissions, right? So by the time
it's
if you
rolling
apply later
admissions.
on, they've seen so many people already. They've already reviewed so many applications and have considered
Exactly.
so many people already. Yeah.
Exactly. So that's I think that's the like main thing is like knowing
Quite.
like to apply early and having all your stuff ready, getting your letters of recommendation ready. Like don't ask letters of rec writers who you don't know that well because they're
Yeah.
not going to write very good letters.
Mm-mm.
And those are also things that are going to help you stand out. Like people are
Yeah.
just trying to like sort through all this to
Mhm.
like try to figure out like, oh, who do I want to invite for an interview?
Yeah.
And then some of these interviews, I think, are they all virtual again this year? I'm not sure.
I think for this year, yes. But probably by
So
next year, well, it depends on what happens. But yeah,
it's
there's still
always nice to visit the medical school.
yeah.
But when they weren't virtual, like when I was like a student, I guess, like way back in the day, they used to have like these weird scenarios. They had like one time in one interview, I remember someone was like, you just ran over your neighbor's dog. How would you apologize to them? And I'm like, oh, that sounds
Sorry.
mortifying. Why would I run over my neighbor's dog? And then I was like, I'm sorry. I didn't get in, obviously, because
Yeah.
my apology wasn't good enough, apparently.
They were like,
Yeah.
sorry. But
Yeah,
you know what? That doesn't matter because she got into that. You know, my friends we always say, if there's one school, it could be in the middle of Iowa, in the farm, and they accept us, we're gonna go to that medical school.
and you're ultimately happy. You just like keep thinking of like kind of like final destination.
Well, you've gone to the medical school years ago, right? And you're already here practicing. Of all the stress that you have gone through, and obviously so many sacrifices, is there any regrets having gone through all of that?
Not big ones that I can think of. I pretty much enjoyed my life. Like,
Yeah.
I mean, so here's the thing, you gotta like learn to be happy with what you have, right? Like I went to college in a very big city. I had access to everything. And for
Yeah.
me, going to medical school was like a shocker. Like, this is the middle of nowhere. Like, where is
Yeah.
this place? Augusta, Georgia. It was just like a very big shock. Like I used to eat like Chipotle
Yeah.
every day for dinner. And like I got there and I was like, there's no Chipotle here. Where am I really? Like
Oh, no.
you know, there's just you just gotta like be like appreciative of like the things that you have. And
Yeah.
then like slowly it like grew on me and like then I was like, I can spend a weekend here or like, and I made friends and I
Yeah.
think, like the main thing is like finding like a supportive community.
Yeah.
And what else? I went to a public school for both undergrad and medical school.
Mhm.
So that was like the main thing is like I think a lot compared to a lot
Yeah.
of other
Mhm.
ones.
Yeah, that's a big thing too. Is it doesn't? Do you think it matters where you go to medical? You said no, right? It really does not matter where you get to medical, where you go to medical school.
Like, doctor, I'm dying. I'm dying. And then
I only want someone from Harvard.
and then they're like, oh wait, which medical school did you go to?
Which medical school?
Like, all right, the next one.
Yeah, I agree. I agree with that fully. But after medical school, and for those who don't know the process to get where Dr. Siri has gone through, 4 years of undergrad, 4 years of medical school, and then the residency years depending on what type of residency you guys. For emergency medicine, how many years is residency?
Most residencies, like some are 4, some are 5, some are 7. And I wasn't interested in going a 7-year one. I was like, okay, 3 or 4, and I'm done. But I actually I wanted to specialize, so I did a fellowship after. So
And that's for ultrasound, right? And
yeah, for ultrasound,
2 years or
it's 1 year.
1 year. But I know there are like subspecialties for emergency med, right? Like I read something about like hyperbaric and undersea
I think
critical
those
care.
are 2 years. It's either 1 or 2 years. Critical care is 2 years, but it's all like very specialized at that point.
Very specialized, yeah. There was one shadowing that I watched where it's like an aerospace medicine, and his specialty was in emergency med. So it just goes to show like there's a lot of things you could do like after emergency medicine, right?
Emergency medicine is one of those fields that's like really really diverse. You're not tied to a specific like patient
Yeah.
population.
Yeah.
I mean, you just treat people as they come. Like some fields you're like tied to a specific patient population. Like if you become like a peds, I don't know, like hematologist, like your patients are just hemonc patients that you will follow in like a hospital or a private clinic, and like that's who you see, you know?
Yeah.
But emergency medicine is not like that.
So diverse. But that being said, do you think there's a bread and butter in emergency medicine, despite how diverse it is? Like you'll come into work tonight and you'll be like, for sure, there's this top 3 that I will see today.
Yeah, you see the same things. You see pain, right? Like chest pain, abdominal pain, back pain. These are all like very, very common complaints. You see like dizziness, weakness, syncope, and then trauma, right? Like these are all like bread and butter things to kind of see in the ED.
Yeah. And where did that thought of, oh, I want to do emergency medicine come from? Is it from rotations?
Like I said, it was from the beginning. Like remember how I was talking about like having that open kind of attitude towards choosing medicine. Like it's like all a journey, right? You like study one thing, like you're knowledgeable about a certain field, but in EM you can always like branch out into doing like other things. Like you can do law, you can do this, you can do that. And EM, like it's so practical. Like you can do wilderness, EMS, like it's just like oh, and if someone is like truly like like needs help, then you can like give it to them, you know? Like someone is on a plane, like is their doctor on board? Hey, listen, you're trained in that. That's you.
Yeah. As the emergency room doc, like you call the shots, right? Someone's coming in panting, like short of breath or trauma or anything emergent. You're the one's going to make the life and death decision for this patient. That's stressful. How does that feel for you as the physician in charge?
A lot of the times the patient has like already made the decision, you know? I feel like there's very little like I make a lot of decisions, right? Like but our decisions are usually like okay, like we just have to keep the patient alive unless they've specifically said like, hey, I don't really want to live or I have like you know, some objection to like certain like treatments and whatnot. So that's already like done, you know?
Yeah. But like clinically.
Like clinically
I know what's
it's
the
hard.
first thing that you
It's
have to
like
do.
really hard, right? It's over time that you like build. So when you're a resident, you're like, I'm not sure. Should I do this? Should I not do this? And like, you know, you always have to think about like what's best for the patient, and then you make a recommendation based on what like medical knowledge you have, and then ultimately it's like a shared decision making. Like, oh, does this patient for example, like need a reduction. Okay, the answer is pretty simple. Yes, they need a reduction. So you do the reduction, right? But then like a decision, for example, like, oh, does this patient need inpatient rehab and like treatment? All depends on like, oh, okay, like, are you like, do you feel like you need to stay? Like, are you functional at home? Like, there's a lot of like other factors involved, but overall, like a lot of medicine is like working with the patient to like make, not just by yourself.
Yeah. So are there times when you like doubt that decision and later on you're like, oh, I could have done this instead? Was there ever a time where you regretted a decision that you made for a patient in the emergency room?
Um, yes, definitely, but I don't think like most of them were like not big decisions.
Yeah.
Like, oh, like maybe I should have done that, but it wasn't like, oh, should have done this and the patient,
Yeah.
you know,
Yeah.
well because of it. Yeah.
Yeah. Can you think at the top of your mind maybe the top one situation in the emergency room where you felt the most scared?
Ooh, most
Whether it's during medical school or residency or even now.
probably like COVID-19, right?
Yeah.
Like, I mean, and what else tops that? You're like not sure what's going on. It's
Yeah.
like going
No
into
one knew what was going on. Yeah.
it's basically like going into an unknown, right? And like you don't know what's going on, so you definitely are unable to like really navigate it, you know? It's like sailing through like a endless sea, but you don't know if it's rain or
Yeah.
shine. Like every minute it's like something different.
Yeah.
So I think that's when I feel like I personally have been scared.
Yeah. Because we both worked throughout the spike here in New York City, right?
Yeah,
Within
last April was terrible.
yeah, in the beginning, we had no guidelines, right, on what PPE to wear. Oh, don't wear a mask. Oh, wear a mask now. And everyone was just getting sick during that time. I mean, especially one of the hospitals in Queens, right? Like, my friends were telling me the ambulance is going off every second of the day. And it was just so scary. And even for our hospital, we had news that, oh, patients were like passing away in the emergency room because we well, one, we were filled up upstairs in the
Mhm.
inpatient beds, and people are waiting in the emergency room, hoping for a placement, and everyone's just not being able to breathe, right? Um,
Exactly.
that those were really scary times. If there's one thing that you learned as a physician during that spike period, the first spike period here in New York, what would that be?
Expect the unexpected. So nothing that you ever do is going to be 100% right, right? Like,
Yeah.
because you don't know until later. It's all
Hmm.
going to be in retrospect.
Hmm.
But I think, like, kind of doing whatever treatments you can that don't do any harm will
Yeah.
always, like, more or less benefit the patient, right?
Yeah.
So, like, oh, okay, like, example, like, soothing their throat by making them drink tea isn't, like, a harmful thing necessarily. It's not going to help them. Like, it's not going to cure their COVID, but,
Yeah.
like, even like supportive therapies and stuff, like proning a patient, like all this other stuff. It's insane. We learned a lot. Like last
Yeah.
year was insane in terms of like critical care and like critical care time and everything.
Yeah, and when the spike started here in New York, I was like a new grad nurse during that time. So I literally just got out of orientation, and then our unit was like changed to COVID ICU, and I was like, what the heck is what the heck is going on? And all of my senior nurses were like, oh, we don't know what to do. This is the first time we've gone through something like this. I'm like, so what am I supposed to do? And I could just feel for the residents during that time, right? And we also had medical students here in New York who we may graduate early, right, to help in the front lines. Like it was just crazy for everybody. And I feel like that's why we are so adamant when it comes to like fighting misinformation because we don't want that to happen again, right?
Of course not. Yeah, it was like a rough time. We didn't even know what was going on, and
Yeah.
we didn't even realize like, oh, this is the right thing to do. This is the wrong thing
Yeah.
to do until like much later. You know.
Yeah. Even Dr. Stella said when I talked to her, she was like, I don't know if people have anything left still to give from
Mm.
what still happened from last year. We saw so many shortage, right? Physician and nurse suicide because of other things. that's taking on emotionally tolling for everybody. But still, there were crazy times pre-pandemic, and this is the most common question that I've gotten is, what is the craziest or weirdest things that you've ever pulled out from a person's body? I feel like this is the go-to question to every emergency medicine physician. I feel
Um,
like that's your specialty.
what is the craziest thing I've ever pulled out of someone's body? I mean, we pull out cockroaches out of people's ears once in a while. That's like a regular thing. You know, like when they're sleeping, they're like, "Oh, I can't hear," and then you're like, "Here's a cockroach." Um, what else? I had a patient once, not a bottle, you know, like those hand sanitizer containers. They're in that like I don't know why they would put it up their butt, but they did.
I
So
bet they'll say they slipped on it.
yeah, the usual.
The
The
usual.
story's always the same, but like
Yeah.
that was like a good one. Nothing recently, honestly. I think people have overcome that phase maybe in their life. So like rectal foreign bodies. Maybe that was a thing of the past, you know, back before COVID was entertaining on a regular basis, like a political basis. Like
Yeah. I bet COVID was like, let's get rid of those times. How do
exactly.
you react to those as an emergency med, as the ones who greet the patient? Are there times where you just want to like compose yourself in situations
I
like that, or
mean,
like
I'm not like
funny
phased
situations?
anymore. I'm like,
You're
oh,
not
okay,
faced.
all right. Like that's there. Let's just
Yeah,
get rid of it. Honestly, it's not my place to judge.
yeah,
Whatever, like, you know, life. They're here for your help and you help them and
yeah.
then, you know, you kind of like go on from there, I feel.
And like we always say, right? Like it takes amount of courage to actually ask for help too.
It does, and that's why I feel like it's important not to like shame people for like coming to the ER for help. I think that's why they're there because they're
Yeah,
seeking help, you know?
yeah, because you don't know what they have tried already at home, right? And it was unsuccessful. So now they feel like desperate to be like, oh, now I actually need professional help. But how do you think COVID changed you as a person? Like, I guess yes, as a physician, but
Mm.
having gone through that and now like a year after, even though we're still, going through the after effects of it,
I feel like
it's like,
made me more emotional. I'm like
yeah.
not that like emotional in general. Like I feel
Mhm.
like, well, yeah, sure, to a certain extent, but like when it comes to work, like, you know, I have empathy, I have compassion, but like COVID, like really like it fucked with you, you know? Like it was like
Mhm.
this patient was fine yesterday. Why are they gone today? Like, or
Right,
okay, this patient is like gonna die, and I feel so
right.
terrible. It's also like because you were there, like when no one else was, you know, like patients like dying without family members, or
Ugh.
all of their family members like are in the hospital. So you're like, oh wait, their father, oh he's like upstairs, like he's in another room, like they all have COVID-19, you know.
It really sucks. Like we had a patient on our floor who has been there for like 4 months, like prior to COVID, had a heart surgery, had a knee surgery, had MRSA, had everything, was still alive, but it was COVID that took them away. So it was really rough times too. And just being there, right? Like just being in the room, seeing everyone like pass away, and then when you get out of the hospital, right? You hear news like, "Oh, it's a hoax! It's a hoax!"
Oh my
It's
god,
it's
that was
actually
like the
not.
terrible. That was
It's
like
not
the
that
terrible
bad.
time. Like,
Yeah, 99
it's not
percent
a
survival
hoax.
rate.
It was a hoax. Like, why would I like cancel my wedding, cancel my vacation, cancel my honeymoon? Like, I literally had like everything that I was looking forward to like canceled, and I was like super sad. I was like, all right, here I am at work again.
How about now? We've been hearing news about the Delta variant rampaging around the country. How is New York looking right now, especially in the
I mean,
the emergency
cases are
room?
up in New York City too, but I think like vaccination has offered a small level of protection in
Yeah.
terms of case rate here. Or, you know, if people are sick, they're pretty much asymptomatic. So that's like good news for here, at
Yeah,
least.
for sure. Because we've been seeing the other doctors post online, right, of those in the ICU who were unvaccinated, which is so sad because it really does take a toll on us too. Because I
Yeah.
get it, right? Like we can't save everybody,
No,
but
we can't.
yeah, but we try our best, right? To I feel like to give as much as we can. Well, beyond that, let's talk about ultrasound. I look at ultrasounds and I'm like, what the heck is going on? What am I supposed to be looking at? Like, I look at the echoes, I look at the other scans, I'm like, what am I supposed to be looking at? Does that just come with time? Obviously,
So in
they
medical
train
school, you
for
go
it.
to anatomy
Yeah,
class. Like ultrasound is just like a visualization of that anatomy through the surface. So
yeah.
you have to be like good at like knowing where things are. And so like learning a lot from that anatomy class, like which you will. Like some doctors like rarely use like anatomy after that, but ultrasound, like you're like, oh, okay, that's like your right renal artery, like running right below your gallbladder.
Yeah,
It looks really big, or
yeah.
like things that are like not as intuitive. Like it's all through anatomy that you learn it.
But still, you don't use OChem, right? I
I
just finished the
rarely
final
use
today, so I'm
OCAP.
still kind of
I'm
bitter
trying
about
to
it.
think of a scenario where I use organic chemistry. I
Is
mean,
there?
we use like in pharmacology, like you have to know like, okay, if this medication a patient can't take, what's the mechanism of action,
Yeah,
otherwise, and why is it effective or whatever.
yeah.
You have to know like some degree of like biochemistry, I would say, more
Hmm.
than organic chemistry.
Yeah,
Um, like the cells interact in this way, like
yeah,
this is why this medication works.
yeah. I agree. And how do you decompress from work?
I eat a lot of good food in New York City. Exactly.
I mean, I always comment on your like food stories, right?
Oh my god, I'm like addicted, and that's how I do it. Okay, everyone has their own like decompression. Like,
Yeah,
you know, you just got to figure out what does it for you. You know.
yeah,
And I
yeah.
also go on like vacation when I can.
Traveling is the way to go.
But traveling is also like exhausting, right?
It is though. Yeah. I went to Hawaii back in March and it was a 13, 14, 15 hour flight. And the whole flight I'm like, wow, this could have been a whole shift in the hospital.
Oh my
So
god, that is so true. These
yeah,
long
but
trips.
it's like it's worth it. It's beautiful. Do you have like future plans with in medicine still? I mean, EM doc, ultrasound fellowship is
I mean, I am like an attending, and I guess like we'll see where life takes me. Hopefully, I'm going to ASAP, which is our like conference for emergency medicine physicians. I don't know what future plans means, but I teach at Columbia, and that's rewarding. I work with residents there sometimes, and that's also rewarding. Like I take it one day.
yeah, I agree. How does it feel like now that you're an attending and teaching residents like that was you before, right? Like
I know exactly what it's like to be in their shoes because we were once in their shoes, right?
yeah.
So it's like it's exactly like what you imagine it to be.
They always say they also say this like in TikTok, like every specialty has like its own aura and environment. Like they say, oh, surgery is like mean and neurosurgery is like so strict. How was emergency medicine training for you? Like how were the attendings?
It's
Well,
like
you're an attending now, but
it's always the coolest people, and
oh,
everyone's so
okay.
flexible and
Uh-huh.
minded. I feel, because we learn to deal with everything, right?
Yeah.
So we learn how to manage like different personalities,
Hmm.
whatnot. And most people are like not type A, so it's really, really like nice in that way.
That would be nice because there are some specialties where I feel like all the type A people go into,
Yeah,
right?
people aren't. There are still some, but that's like,
Yeah.
that's just who you are. You can't control who you are.
Yeah, I agree. And do you like how medicine has advanced so far in the sense that when you were a student, is this what you expected when you were in school? Like
Uh,
the life you're living now as an attending?
I didn't know what to expect because I didn't have
Mhm.
anyone in medicine.
Yeah.
Most of it was from like seeing people like in medical school, and I think like this is like the lifestyle more that I wanted. which is like shift work. Like I go into work, and once I finish work, I'm kind of.
Yeah, and you just started moonlighting too, I saw.
Oh yeah, I moonlight once in a while.
Oh, you did.
I did moonlighting as a resident too.
Oh, you did.
Yeah, we did event medicine, so we got to go to all the like Madison Square Garden, like kind of concerts and games.
Oh, that's
Yeah, it
nice.
was super fun. But yeah, I just picked up this one shift and it was like fine. I honestly think like it was more for like the experience.
Yeah, I agree. Thank you so much. Like it's been so inspiring talking to everybody. I'm so grateful for the time that they spend with me, especially you. Thank you for spending time with me in this hot.
I feel like
Um,
we're inside. It shouldn't be this hot. I don't know why my thing keeps dying.
I have no idea, and I really don't want your phone to explode. I'm not
Oh,
just,
I think yeah. I was like,
I know it overheated like 3 times,
I
but
know, and I was like, what the hell? Like right in the middle.
I know this is the first time it happened to you during a live stream too.
Yeah.
I think it's our combination.
Oh yeah, maybe.
I think
Maybe you're
Instagram just
just too
couldn't
hot
handle
to
it.
handle.
Yeah, we're just no,
Damn.
just that's you.
Get in
Yeah.
some ice.
Is there a filter here with fire?
Oh, that would be so funny. Hold on, let's check. Oh,
Let's
there's
check.
this one. There's a Ray filter.
You know what? Let's cool down and thank you so much for
Thanks so much for
spending your
having me.
thank you so much. Have a good rest of the night. Thank you
Have a good
everybody.
day.
You
Thanks for
too.
having me.
Bye.
Bye.
Bye. Bye.